You're listening to Where Before Meets After.
DiamondGlow, is it affordable?
Absolutely. It's like the best starting price. Like I said, to kind of introduce you to these type of treatments, it's around $175 for the base treatment.
How do you describe it if someone's never had it before?
I say it's the best like introductory to aesthetic treatments because it's a great way to like prep your skin for maybe your more, aggressive treatments, your more biostimulants. But it's also nice to like maintain your results from your other treatments too. For just kind of like keep up on your results.
How often do you get one?
I have some people that are on it monthly, religiously. Yeah.
So does it have any kind of side effects at all?
Not really. You can have like a little bit of flushing, like directly after, just from the suction of the handpiece. So possibly be a little bit red, but other than that, like just instant glow. Instant like look beautiful, call it the red carpet facial.
What kinds of things do people say right afterward? Like, especially if it's the first one.
After the first one, they're always like, oh, I just feel so much more like lighter. My skin feels so open and moisturized and hydrated.
What if you have like little, I hate the words, I don't even want to use them. But like, what if you have little, let's call them blockages? Or you want your pores to be cleaned out? Can it do that too?
Yeah. It's really great for extracting, we call it little gunkies within the pores. So all your,
that's a good
dried sebum or just built up product that's maybe like acting as a protective barrier. So your other product, like your SPF isn't properly penetrating. It's kind of sitting on top. It's really nice for removing that.
Could you do it more often than once a month? Like, is there any reason why someone would want to be more frequent than that?
I do feel like that's a good, like 4 to 6 weeks is a good timeline in between your DiamondGlows because we do typically add on, a dermaplane. So we want that hair to kind of grow back before taking it off again. And then we do want that cell turnover rate to kind of kick in. And so you can enjoy your results before redoing
What's
it.
dermaplaning?
Dermaplaning, we take a medical grade scalpel and graze it along the skin so that we remove the first top layer of the skin and then mostly that vellus hair that's kind of acting as a protective barrier for really expensive skincare so it doesn't properly penetrate.
How long does it take to do dermaplaning?
It's a really quick add-on to like any treatment that you do. It's a great way to kind of prep before even your chemical peels or your microneedling, but really, really great with the DiamondGlow.
Do you do it before the DiamondGlow or just after?
Before the DiamondGlow.
So how long does the whole appointment of a DiamondGlow and a dermaplane take from beginning to end?
The whole appointment takes around 45 minutes. So we'll kind of prep the skin, do a nice cleanse, sometimes a little bit of like chemical exfoliation within the cleanse. We'll do the dermaplane, remove all that vellus hair, and then we'll go in with the DiamondGlow and actually infuse it with all those Skin Medica ingredients.
Oh, what's in those?
You can get really customizable within the DiamondGlow and kind of target what you're specifically looking for. So they're even and correct, which is a tranexamic acid base. So really great for your hyperpigmentation, kind of softening up your browns and sun damage. And then their TNS, which is their growth factor serum, which is amazing. And then their HA5, which is hyaluronic acid, of course, which is a natural molecule the skin already makes. And so it binds water molecules to the skin. So it boosts that hydration and nice plumpness to the skin. And then also vitamin C and a little bit of a pure pore serum.
If you have really sensitive skin and you're prone to like turning red for no reason, like if somebody looked at you funny and you turn red, like that kind of skin, are you able to kind of customize what goes into those formulas so that it doesn't, trigger something unexpected?
Yeah, absolutely. If you have more sensitive skin that's like maybe prone to acne or prone to breakouts or even just flushing that happens, we can kind of turn down the suction so it's a little less aggressive and not causing as much circulation to the surface of the skin. And then we can also change up the serums to make sure it's not making the skin reactive to anything.
You've done this a lot, I imagine. You've probably done thousands at this point. Like, can you kind of tell when you need to back off a little if somebody's skin starts reacting? Or like, how do you think about that?
Yeah, I'm always watching and paying attention to the tissue response during the treatment. I don't want to, flare up the skin too much to the point where it can't come back down, because we always want maybe a little bit of acute inflammation to kind of get that circulation to the surface of the skin, get that beautiful glow, but we always want it to be acute and not chronic. So,
What are the treatments of the past that have been replaced with something really wonderful like DiamondGlow?
mostly I would compare it to a microderm from back in the day, but the microderms were on dry skin, which, yeah, causes too much damage to the surface of the skin. It causes too much tugging. But within the DiamondGlow, we still have that diamond grit technology, so we get that manual exfoliation. But we're adding a little more slip with that Skin Medica ingredient that we're infusing, so it causes kind of less tugging to happen. It's a lot less intense than what that used to be.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.